On the postnatal ward, as you walk in, you'll have the desk area where the midwives are. Then you'll have bay areas. They may be 4 to 6 bedded bay areas where there'll be 4 to 6 mothers and their babies as well. And there may also be some single rooms as well. Single rooms are usually for women that have complications or have extra needs. So you may be able to ask for one of those rooms. Sometimes in the hospitals, there is the option to pay extra for a private room if it's available. And that's something that you can ask any of the staff about. If you do have a private room, you may have your own shower and toilet, or you may have a shared toilet. If you're in the bay area, there will be a shared toilet there. The staff that you can expect to come into contact with in the postnatal ward are midwives, student midwives, support workers, and cleaners. And also you might have some staff that are delivering the meals in the daytime as well. Also on the postnatal ward, you might come into contact with the doctors. So you'll have the consultant doctor, who's the most senior doctor. Then you'll have a registrar, and then you'll have a senior house officer, sometimes referred to as an SHO. You can tell the difference between the staff members because they'll usually have different coloured uniforms on. So that might be a tunic dress or a top and trousers, or it might be scrubs. But the colour that they wear will often denote their role and responsibility. And if you are not sure, please ask the staff member. Your student midwives may have one particular colour of tunic on, and they might have epaulets on their shoulder. And that's little pieces of material that might denote that they're a student. And they may have 1, 2, or 3 little epaulets to denote what year they are. If they're in the first year, they'll have 1 epaulet, etc. The doctors are usually dressed in normal clothes, or sometimes they may have a white coat on. The doctors usually come round on the ward, maybe once in the morning and maybe later on in the day. They'll have a chat with the midwives and they will discuss all the patients on the ward and who needs priority care. And then the doctors will make a schedule for the day. So the doctors may come in your room and say hello to you, or they may discuss your case outside of your room and not need to see you. If they do come into your room, then there may be the senior doctor, the consultant, the next doctor, the seniority, the registrar, and then lastly, the SHO or the senior house officer. Or you may only see one of the doctors. You can ask the doctors any questions that you are concerned about. So one very important thing to do is to discuss with the doctors that you're autistic and that you need them to communicate in a certain way, depending what's best for you. So maybe you might need lots of information in small chunks, or you need lots of time to process and ask any questions and discuss that with them. You can express that yourself, or you can ask your partner to express that, or you can have it written down for when they come in the room to visit. And also you can ask the midwife to ask questions on your behalf. You'll be able to go home when your bleeding is normal and baby is feeding well and there are no other concerns or complications. And that can happen within maybe 6 to 8 or 10 hours after birth, if everything went well and there was no complications, or it can happen to be let home maybe 2 or 3 days later post cesarean section. And it depends on your hospital's policy. If you're in hospital and really struggling with the hospital environment, please discuss with the staff there if you're able to negotiate going home earlier than expected, because you may be able to come back the next day for an appointment or something like that. The only other thing that will be needed will be a head-to-toe check for baby and that will be done by the paediatrician, the baby doctor. They come round the wards and they do those every day. That won't necessarily happen straight away. It has to be done at least 6 to 8 hours after the baby was born. Sometimes it is possible, if there's no complications, to come back the next day and have that done by the paediatrician if you really want to go home that night. But please speak to the staff, discuss your needs, and they'll put a plan in place for you. So every day, the midwife or student midwife will come and do checks on yourself and your baby. She'll want to see how you're doing, how you're sleeping, and how your mood is. Please ask for help if you are struggling or you need any extra support or you're worried, and the midwife will make a plan of care with you to support you. And the midwife may do your blood pressure with the blood pressure machine, check your temperature, and check your pulse. The midwife will also ask about your breasts and your nipples, and ask if there's any soreness or tenderness, and ask about how full your breasts are. And that will be in order to assess how well the breastfeeding is going if you're breastfeeding, and to give you advice about breast care if you're bottle feeding. Also, the midwife will want to feel your abdomen and to make sure that your uterus is contracting down post-birth. And that means that you'll just want to touch your abdomen gently and assess if there's any pain there for you as well. And again, if you have any concerns or worries, tell your midwife and she will support you with that. If you've had a caesarean section, she'll want to check your scar for healing and make sure that is all looking okay. And she will discuss wound care with you. She'll also want to check your bleeding to make sure that that is all in order. She may ask to look at your sanitary pad to assess the kind of blood loss that you're having. Don't be alarmed if they do ask to see that. The midwife may also ask about your bowel movements and about how often you're passing urine. And again, that's just to assess that your body's starting to recover correctly post-delivery. The midwife may also ask if you have any pain or swelling in the back of your legs, and that's to assess if you might be at risk of having a blood clot or a deep vein thrombosis, which can be a complication of pregnancy. Some women are given injections to help thin out the blood and prevent blood clots. If that happens with you, that will all be explained for you. The midwife will want to strip off baby and check baby's skin and make sure there's no signs of any concerns or infections. The midwife will ask how often baby has been weeing and how often baby has been pooing. The midwife will also ask about the colour of the poo. When babies are first born, the first couple of days, their poo is a very dark colour, almost like tar, and then it will start to get to a more brown colour, a lighter brown. And that lets the midwife know that the baby has been feeding well. Also, the midwife will ask how baby has been in themselves and if they seem distressed at all, and how you're feeling about bonding with the baby. Again, please talk to the midwife about any concerns you have about your baby and anything you want to ask them about. The midwife, the student midwives, and the support staff are all there to help you with that transition into motherhood.